The following program is a paid presentation for TheraSil.
Welcome to this special show with breaking news about women's health issues regarding some of the most cutting-edge technology in hormone revitalization. Do you experience hot flashes, reduced libido, chronic fatigue, unwanted facial hair, weight gain, and insomnia? If you do, the situation might seem dire. If you've experienced hormone imbalances, you may be feeling frustrated, alone, confused, wondering what the solutions might be. In the past, you may have turned to hormone replacement therapy, but with so much information coming out in the media, so many studies being done showing the risk of HRTs, what are you to do? If you are feeling confused, if you are feeling alone, I've got a solution to this. A solution in which 95% of all women associated with hormone revitalization benefited. What is this all about? Well, in the next half an hour, you're going to learn about the difference between hormone replacement and hormone revitalization. And here to tell us about it is Dr. Teresa Dale. I'm pleased to introduce Dr. Dale to everyone.
Thank you so much. Thank you.
You know, I'm so impressed. You're the founder of the California College of Natural Medicine, a naturopathic doctor, a medical consultant. You're also the author of the book, Revitalize Your Hormones, Dr. Dale's 7 Steps to a Happy, Healthier, and Sexier You. And you're here to explain to us the difference between hormone replacement, which we've heard so much about, and hormone revitalization, which might be new to all of us. But before we dive into the heart of the matter, I want to hear your story. What has led you to your work?
When I was 22, I was diagnosed with a serious illness. And I decided that I would embrace and encourage and empower myself to find a solution. Therefore, I educated myself and had amazing results. And now, 40 years later, I'm here to help a lot of other people with feeling empowered in their own health issues.
40 years, that's incredible. And you look absolutely fantastic.
Thank you.
You know, I want to know your secrets, and I think we're about to dive into them right now. Before we get into hormone revitalization, I think we need to explain to everyone what hormone replacement therapy is. There's been so much regarding this in the news most recently and so many studies done. But for someone who may not be associated with this, what is it?
It's a medical system that incorporates drugs to deal with women's hormonal issues stemming from premenopause, postmenopause, hysterectomies, postpartum depression, insomnia, depression, and various other issues that women have, like that are suffering from PMS. And the hormone replacement actually is designed to boost hormone levels in a woman, to replace hormone levels in a woman, and carry serious side effects.
You know, and I've read so much about these serious side effects. In fact, I was startled and alarmed to hear about studies done, for instance, the Women's Health Initiative study, where the HRTs, hormone replacement therapies, were actually given to women as women were being, their hormone imbalances were being studied. What happened with this study?
The government had this program through the Women's Health Initiative, this study, where women were tested for many years to see the effects of various hormone replacement therapies. And the alarming results was that women had serious side effects and serious health issues because of using the hormone replacement therapy. And because of this reason, the study was halted, it was stopped.
You know, and I read about some of these side effects, and in fact, I want to share them with everyone today. It was reported in the American Medical Journal. Now, think about this, 26% increases in breast cancer.
That's amazing.
During this study.
That's amazing.
It truly is 22% increase in cardiovascular disease among women involved in this study, 41% increase in strokes. And if that's not enough, think about this, 100% increase in blood clots in women involved in this study. That's scary. So what happened?
It's really enough to make women do exactly what they did. They just refused to take hormone replacement therapy. You know, and actually in 2006, December of last year, they came out with another study that was cited in Bloomberg Report and New York Times and Newsweek, and what it said was since women refused hormone replacement therapy and stopped using it, there was an unprecedented 7% decrease in breast cancer. Isn't that amazing?
That's amazing. A 7% decrease in breast cancer.
Because they stopped using hormone replacement therapy.
Hormone replacement therapy, to me, doesn't sound like an alternative that I want to take part in my own health. But then where do we turn? If hormones are out of balance, if we are imbalanced, what do we do? You're talking to us today about hormone revitalization. What's the difference between replacement and revitalization?
That's a great question. That's what women all over the planet want to know. They want to know, how can we do this safely? Well, we have some really good answers and solutions for you today. If you think about hormone replacement and if you read about these case studies, you see that what it does is it creates a dependency on the body, it causes a toxic buildup, and the side effects of a toxic buildup can be depression, insomnia, weight gain, and just not feeling like yourself, not feeling healthy, and it's absolutely indicates that hormone replacement therapy can affect and burden the immune system. So instead of it being anti-aging, when you shut down the body's ability to make its own hormones, the body ages. In comparison, hormone revitalization allows your body, encourages your body, supports your body to make its own hormones naturally. No replacement going on, it's revitalization. It's actually good for your body, has absolutely no toxic side effects, and before and after testing, we've done thousands of them, third party with other doctors' patients. So we know what it's going to do. There's no surprises. And we're very, very certain that through the test results that we're going to show you people today, that there's just amazing success with these products.
So as we talk about hormone revitalization today, I'm very pleased to introduce to you a formulation that at one time was only available through medical and healthcare professionals, now available to you today through this special television offer. This is called TheraSil, hormone revitalization. How do I use TheraSil when I get it at home, and what can I expect?
Oh, very, very easy. This is one we're going to use on you right now. It's a medical grade transdermal cream, and you apply it to the skin like this, and it has no fragrance that you can be allergic to, no toxic chemicals or toxic preservatives.
So it's all natural, it's not a synthetic.
It is really completely natural, not a synthetic, and it allows the body, supports the body in rejuvenating its own hormones.
It's
Doesn't that
safe
feel
for me to
great?
use, it's not an
totally
ingestible.
Safe to, right, it's totally safe for you to use, or for anyone to use.
You know, a lot of people are probably wondering, and I know that we've talked about this, we've touched upon it, but instead of being hormone replacement therapy, what we are talking about is revitalization, and this is not a hormone that I am placing into my body. Am I correct?
You're correct. It is not an ingestible, it is not a supplement, and it is not an herb. The individual remedies in here create a proprietary formula, and this formula is very, very unique and very tested. Now, the individual remedies have been used for hundreds of years with women for these exact issues. Now, I have put them all together in a formula so that it has a broad spectrum approach for helping women to balance their hormones and have a healthier life.
You know, in just a few moments, I want to share with everyone the studies done on TheraSil, on this formulation. But before we get to that, if you're just joining us, we've been talking to Dr. Teresa Dale, medical consultant and author of Revitalize Your Hormones. Dr. Dale's 7 steps to a happy, healthier, and sexier you. We've learned that there is a direct correlation between the use of hormone replacement therapy and increased rates of breast cancer and other negative side effects. And what are women to do? Well, her research has led us through breakthrough alternative to hormone replacement therapy called TheraSil. Rather than replacing your hormones, TheraSil revitalizes and rejuvenates your body to produce hormones. Whether you're premenopausal, menopausal, or postmenopausal, you can benefit from TheraSil. It's a simple 3-step program available without a prescription. It's 100% natural, safe, and effective. In fact, over 1,000 test cases, hormone levels were brought into balance within a short period of time. If you suffer from hot flashes, reduced libido, chronic fatigue syndrome, unwanted facial hair, weight gain, or insomnia, then TheraSil may be for you. If you would like more information about TheraSil, I encourage you to pick up the phone and call the number that you see on your screen. It was developed with support from a medical community. The proprietary formula is registered with the FDA and until now has only been available through medical and healthcare professionals. There's no obligation and no risk because TheraSil is available for you to try under our risk-free trial program. Today, we've worked out all the special arrangements with our guest. Mention this program and find out how you can get Dr. Teresa Dale's book, Revitalize Your Hormones, free just for asking for details. If you or anyone close to you has ever experienced symptoms associated with hormonal imbalance, then please call for more information. You won't want to miss out on this risk-free trial offer on TheraSil. If the line is busy, please keep trying. We have a very special guest joining us today. We have a medical doctor on the phone lines, Dr. Margaret Gennaro. Let's welcome her into the show. Welcome in, Dr. Gennaro.
Thank you.
It's such a pleasure to be able to speak with you. I know that you have a personal history using Dr. Dale's products yourself. Can you tell us about that?
Yes, absolutely. I was a conventionally trained board-certified pediatrician who had gotten ill with fibromyalgia, chronic fatigue syndrome, and irritable bowel syndrome, and I was introduced to holistic medicine about 10 years ago, which changed my life and my practice. Because of that, I started my own full-time holistic practice for children and adults in Fairfax, Virginia, about 7 years ago. Now, having been a pediatrician, I didn't know anything about female hormones, and I was never quite comfortable with the bioidentical hormone craze. I then became exhausted after some chemical poisoning, and I started to use Dr. Dale's hormones. And I could tell the difference immediately. I had more energy, my libido increased, and my vaginal dryness was gone. They were a lifesaver for me, as I have a very busy holistic practice. Since then, I have used her products on hundreds of my patients, and even those that are very sensitive have tolerated them with very good to excellent results. I really recognize how important it is to boost my patients' ability to help themselves, which is a major tenet of the holistic medicine philosophy. I also took a course with Dr. Dale, and I was impressed with her good heart and her commitment to empower people to help themselves. She's ethical and she's dedicated to helping people, and I highly recommend, without reservation, her products.
Wow. Well, thank you so much for your story. I know that you hear stories like this time and time again, but coming from a medical doctor, that must make you feel fantastic.
It does, and she's a very special person.
I can tell. Well, thank you so much, doctor, and we will let you go, but I do appreciate you phoning into the show.
My pleasure.
Bye-bye.
Bye-bye.
We talked about the studies, 1,000 studies done in research for TheraSil, for this formulation.
Yes.
I think we need to get into some of those studies.
Okay.
I have now learned that TheraSil is safe. It's all natural. But I want to know now, how does this work in conjunction with the studies that you are showing?
Well, you know, one thing that's so very interesting about this is that these issues we're talking about with hormone replacement is not my philosophy. It is from thousands of tests before and after. And what I want to say is, I don't believe, I don't see, I have never seen any proof that there is any safe hormone replacement therapy. All of them are suspect of being a carcinogen to the body.
And this is not a replacement therapy. This is a revitalization,
This is a revitalization
therapy.
So it's completely different. And I also want to say that the only hormone, the only bioidentical hormones that are really safe are the ones you make yourself in your own body.
You know, I find it fascinating because this is a revitalization therapy which encourages the body's natural production of hormones. This is going to make you feel like the you once were. This is going to make you feel more vibrant, more energetic. You know, I want to really dive into this because I think that knowledge is power. We've all heard about the bioidenticals. You've just brought that up. Bioidentical, I don't even know what this means. Are they really identical?
They synthetically make them identical. But, you know, any hormone that is produced from outside of yourself can never possibly be like natural, like what you would produce yourself. Let me show you that. Here is a case history of a woman who had severe side effects. Angry, aggressive woman, very upset all the time, and was just totally emotionally out of control. And if we look at her test, we can see why. Her progesterone level was 286, where it shouldn't be more than 120. Her testosterone, from using bioidentical testosterone and progesterone, by the way, her testosterone is 693.6. It should not be more than 60. It should be between 20 and 60. Her estradiol was 13.5, and it shouldn't be more than 1.5. So it's just astounding when we look at this to know that bioidentical hormones are really not bioidentical at all. Otherwise, it wouldn't create this effect.
We've talked about hormone replacement therapy, and now we've talked about bioidentical hormones. And those are alternatives that millions of women are turning to as a way to be able to deal with their hormone imbalances, among many other things. You just talked about a woman who you mentioned was emotionally out of control. You couple that with the feeling of frustration and not knowing what to do for your own health.
And why you're out of control.
And why you're out of control. So then you start to look for alternatives. One thing that a lot of people are turning to are natural hormone therapies, or so-called natural per se. I know that there's some before and afters we want to show on that as well.
Absolutely. Here is a woman, 36 years old. Her progesterone level is 6,650. It shouldn't be more than 120. And her estradiol is 0.9 before using Therasol. After using Therasol, her progesterone was 74.4 and 1.6. Now, she had a lot of hormonal issues. She was 36, and she was feeling very tired and still with a lot of anxiety. All of those symptoms shifted after using Therasol on her body for only 3 months.
That's fantastic. You know, and I look at these studies and all of these levels being so high. Can you talk to us about these people that are coming to you? What is making these levels so high?
Well, it's hormone replacement therapy. It's the body building up at toxic levels of hormones from taking hormone replacement. Hormone replacement actually ages the body. It builds up. The body starts having various symptoms, and the person experiences emotional distress, extreme depression sometimes, and severe insomnia, hair falling out, weight gain around the middle. This is just not an option anymore. We don't have to go through life like this.
Absolutely not. And with Therasol, you're not putting a hormone in your body. This is not a replacement therapy. This is a revitalization. This is encouraging the body's natural production of hormones.
This is in harmony with what your body would do naturally.
You know, what have you heard from so many of your patients? What makes this so unique?
They are thrilled, they are excited, and they can't wait to tell their friends. And so it's very interesting. Most of the time, I speak with the doctors that use the program because it's been available only to health providers for years. But the stories are amazing, and a lot of those stories are in the new book.
Can you say how long it will take until we can start to experience results with Therasol?
You know, it's so interesting. It varies, but sometimes women put it on, and within minutes, the same day, they say, oh my God, I feel better. And sometimes it takes a little bit longer. It depends on the complexity of the situation. But normally, women take it for about 3 months. They use it for about 3 months. And within that time, they can see very significant differences.
Who is Therasol for?
Therasol is for women with any hormone symptoms, such as depression, insomnia, hot flashes, weight gain, and postpartum depression and PMS issues. And also, Therasol will start working very, very quickly after you start using it. Most people experience that. That together with what you learn in the book to educate yourself on how to eat correctly, an endocrine rebuilding diet, a good nutritional plan. This is all very important in a woman's total health.
I love it. You know, if you're just joining us, we've been talking to Dr. Teresa Dale, medical consultant and author of Revitalize Your Hormones. Dr. Dale's 7 Steps to Happier, Healthier, and Sexier You. We've learned that there is a direct correlation between the use of hormone replacement therapy and increased rates of breast cancer and other negative side effects. Well, her research has led us to a breakthrough alternative to HRTs, and that is Therasol. Rather than replacing your hormones, Therasol revitalizes and rejuvenates your body to produce hormones. Whether you're premenopausal, menopausal, or postmenopausal, you can benefit from Therasol. Now, it's a simple 3-step program available without a prescription. It's 100% natural, it's safe and effective. In fact, in over 1,000 test cases, hormone levels were brought into balance within a short period of time. If you would like more information about Therasol, I encourage you to pick up the phone and call the number that you see on your screen. It was developed with support from the medical community. The proprietary formula is registered with the FDA and until now has only been available through medical and healthcare professionals. There's no obligation and no risk because Therasol is available for you to try under our risk-free trial program. And if you mention this program, you can get Dr. Teresa Dale's book, Revitalizing Your Hormones, free, just for asking about the details. If you or anyone close to you has ever experienced symptoms associated with hormonal imbalance, then please call for more information. You won't want to miss out on this risk-free trial offer on TheraSil. If the line is busy, please keep trying. What are you doing that's so different with TheraSil that no one else is doing? What does revitalization really mean?
Revitalization, if you can just, people can just get their head wrapped around this word. This means we actually reduce the biological age of the body. We make the body younger. The body relaxes. The adrenal glands get less stressed, and so they start making the correct amount of hormones. You see, when you've had a complete hysterectomy, your adrenal glands can make all the necessary hormones that you need, so that you don't need to rely on hormone replacement when you have hormone revitalization.
You're encouraging the body's natural production of hormones versus
Right.
taking a synthetic and replacing hormones that are on the decline. What I find to be fantastic are the stories that I've heard about how through hormone revitalization, you get to know the old you used to be. You get a chance to feel like your life is in balance again. You get your emotions back in control. You start feeling like you, as opposed to feeling like you're under control with something else, a synthetic
It's
drug or an emotion.
Absolutely correct. And you know, we have one more test that we wanted to show you. And this other test, I think women really deserve to know the truth. If you want to know how quickly it works, how quickly TheraSil works, we have a before test that we'll show you of a woman who is on bioidentical hormones. And her progesterone levels is 1,780 when it shouldn't be over 120.
Oh my.
1,780, okay? Not to mention that her adrenal cortisol levels are out of balance, her DHEA is low, her estradiol is 3.0, and it shouldn't be more than 1.5 because she's postmenopausal. And even her thyroid TSH is very slightly off. Now, this was such an emergency that we decided to start the use of the product and then test her again in 2 weeks. Now, normally in blood tests, you would never see results in 2 weeks because it's not sensitive enough. What we did was 2 weeks later, we did another saliva test just for her own benefit to see how it's working, how quickly it works. Well, it's very clear to see that in this saliva test from this licensed lab that the progesterone that was 1,780 is now down in 2 weeks to 462. It's still not normal, but it's only 2 weeks. So in 2 weeks, we have a dramatic decrease going in the right direction. And we also have, thank God, a decrease in her estradiol because her estrogens were way too high. And her TSH, everything is looking very good and going in the right direction, so we can see results very quickly.
You know, I'm so excited because at one time this was only available through the medical and healthcare professionals. But today, through this special television offer, we are offering this formulation, TheraSil, to you. We have one of those medical professionals joining us right now via telephone. We have Dr. Eric DeYoung calling in, and his practice is in Kentucky, I understand. And I believe he's on the phone lines right now. Welcome in.
Thank you.
You know, it's so good to be able to talk with you. I understand that you have a personal relationship to TheraSil as well as a professional one. Am I correct?
That is correct.
First of all, tell us about the personal.
Several years ago, I met Dr. Dale at a naturopathic conference, and she was talking about hormone rejuvenation. And several weeks after I left that conference, I started integrating her protocols into my practice. And not long after that, my wife and I had a child, and my wife had symptoms of postpartum depression. Her traditional doctor wanted her to use prescription medications and antidepressants, and that wasn't a part of her therapeutic protocol herself. So we decided to utilize Dr. Dale's protocol. In about 45 days, my wife had complete balance of her hormones. She was back to being herself and being able to engage back into her life.
That's fantastic. And, you know, what do you hear from your patients? Are they giving you any feedback about TheraSil as well?
They're all having about the same experience. They're talking about being able to feel healthy in their life, more balanced, being able to engage back into the activities that they enjoy, feeling that they have more meaning and purpose in themselves, and they're not addicted to any kind of medications anymore.
That's fantastic. It's so nice of you to be able to call in and speak
It
with us.
is.
Thank you so much
Thank
for your
you,
time.
Dr. Young.
You're
Thank
welcome.
you very much.
Thank you.
Bye-bye.
Bye-bye.
That must feel incredible to be able to hear feedback like that.
Oh, it does. I hear it all the time, and that's why we're here today, to share it with the world.
And Dr. Dale, I think it's so important that everyone understands this. Therasil is not a drug. This is not a supplement. What it is, it's actually a homeopathic formula, which is registered by the FDA. Can you explain to me what that means?
That means that this is non-toxic, this is not hormone replacement, this will not age your body, this will not cause dependency on your body for any reason. This will revitalize and allow your body, support your body, and encourage your body to make its own hormones. That's exactly what this does. Simple, easy, and effective.
So why do you say your treatment can lead to a happier, healthier, sexier you?
Well, you know, that's a great question, Kim, because obviously when a person's hormones are out of balance, they are just not feeling themselves. So when you're feeling imbalanced, when you're feeling like your emotions are more imbalanced, that you feel like you're getting control of your weight, you feel like your mood swings are better, you can sleep better at night, when you feel like your hot flashes are no longer there or they're severely reduced, you feel like your sexier self. You feel like you haven't felt in years, and that's really what we want to bring to people.
Absolutely. Why would women put themselves at risk when it comes to the HRTs when there are alternatives out there?
Absolutely. I don't think any woman today would want to put themselves at risk. I think they've heard the news, listened to their friends, they've just heard it all, and now they're ready to make a serious change in their decisions and want new choices.
And this is going to encourage their body's natural production of hormones, allowing them to be the person they used to be.
And it's very supportive. It's very supportive to what women really want. They want to be whole. They want to feel whole. They want to feel like they, are themselves again.
And do you have any final words for everyone?
Oh, I really do. And I would say that women, I want to support you to make a new choice because your life may depend upon it.
You know, this is about encouraging your body's natural production of hormones. This is not a hormone replacement treatment. Therasil is hormone revitalization. We're almost out of time. If you suffer from hot flashes, reduced libido, chronic fatigue syndrome, unwanted facial hair, weight gain, or insomnia, then Therasil may be for you. If you would like to know more information about Therasil, then pick up the phone and call the number on your screen. The proprietary formula is registered with the FDA and until now has only been available through medical and healthcare professionals. Now Therasil is available for you to try under our risk-free trial program. And today we've worked out a special arrangement with our guest. Mention this program and find out how to get Dr. Teresa Dale's book, Revitalizing Your Hormones, free. Just ask for details. If you or anyone close to you has ever experienced symptoms associated with hormonal imbalance, then please call for more information. If the line is busy, please keep trying. Thank you for tuning in to Hormone Revitalization with Therasil.
The preceding program was a paid presentation for Therasil.